um, this week actually that her condition was stable and that she was no longer a candidate or no longer needing hospice services.
They're saying I don't need it. I've been consistent through the 6 months that they didn't look for me to live. So now that with this consistency has caused me to be kicked out. I can't be the little diva I was trying to be, but it's okay. It's okay. And the reason why it's okay, because that's a good sign.
What's more, Verna and her daughter know that if Verna's health declines, she can always re-enter hospice.
My understanding is that hospice is available to us if her condition changes. And because we know that there's no cure for heart failure, that it's very likely that we may need the services again.
At this point, I don't feel like it's a lost cause, because they tell me you can come back, and that's so nice to know.
And joining me now is Dr. Terry Melvin, Chief Medical Officer of the Hospice of Chattanooga in Tennessee. 3 really remarkable stories again. And you know, you can't say enough how grateful we should be to these people for letting us into their lives, these very personal parts of their lives. But let's talk about Verna Mae for a moment. She gets better. She's discharged from hospice. She goes and gets treatment. She comes back in hospice. Then she's discharged because she's too healthy. How do hospices decide whether a patient should be discharged or not?
In this particular case, the treatments that she needed to help with her symptoms was outside of the realm of coverage for that particular hospice. So she did leave. They treated her symptoms, and then she returned. Prognosticating how long someone has is not easy.
Right. Are you allowed to receive curative treatment while in hospice?
Not curative treatment.
So if you're getting a treatment like that, then you would exit hospice for that treatment. What about in the case of a cancer patient, for example, chemo?
So if the chemo is for cure, then the patient is discharged from the hospice program. But if it's radiation therapy to treat maybe a bone metastasis, a bone lesion, to help with pain control, then you don't have to be discharged from the hospice program.
How about non-curative treatments, transfusions, IV fluids?
The question is, what's the goal? What is that patient's goal? If that patient's goal is to be as comfortable as they can be and their blood counts are low, giving them a little bit of blood's not going to hurt anything. If they get dehydrated and they have a goal to achieve a graduation or a wedding or be around for somebody's birthday, a little bit of fluids don't hurt anything. Chemotherapy, on the other hand, if the chemotherapy is for cure, they will be coming off of hospice.
Let me ask you one more sort of in the weeds question about treatment with patients who are in hospice. If you're in hospice for, say, your cancer, your terminal cancer, but you have medical issues that are not related to that cancer, is that treated within this context of hospice, and how?
It's so much more complicated than just that terminal cancer, because that cancer impacts that whole body. So then that body gets fatigued. Then that body has pain. So then I give pain medicine to the body. So now my body gets a little constipated. Now I get a little bit nauseated. So now I have an infection because my immune system is down. And so we treat the whole system.
Another theme is pain.
Yes.
And hospice is very engaged in helping to manage pain. How do you deal with people? What do you say to people who are worried that the pain management will make them less present?
The goal is not to have them less present. The goal is for them to be engaged. The goal is so that they have relief and still be able to do those things that they want to do. The question is it comfortable to them, and can they provide their day-to-day activities?
So you say we can balance this.
We balance it. We do balance it.
I think, Dr. Melvin, this is a very important point, and I want to highlight that you've just made. Hospice care is about managing a whole body of care around a person who has a limited time left because of their illness.
That's absolutely correct. And the intriguing part of this is when you say a limited time, we don't know what that limited time is. Because sometimes it's a few days, and sometimes in Verna's case, she outlived the expectation, she's doing well, and she graduates.
Dr. Terry Melvin, thanks. Appreciate it.
Thank you.
Great insight. We've been talking about how hospice addresses the patient's medical needs, their physical pain and symptoms, but many people are surprised to learn that hospice can provide spiritual support as well. Let's take a look at that.
Yeah, thanks for coming. It's great you were able to make it.
I know.
Karen Jones is Catholic, and since her illness began, she's received spiritual support from her local priest, Father Paris.
We'll start with do Holy Communion.
Yeah, that'd be great.
Our Father, who art in heaven, hallowed be thy name.
Though Karen relies on her own priest, hospice also provides spiritual support for those who request it. Mickey Fox is in hospice at home, where she lives with one of her daughters, Claudia. Mickey's husband passed away more than 20 years ago. She suffers from a heart condition.
I have this aortal valve that needs to be replaced, and I chose not to have the open heart surgery because of the risk.
Mickey could have joined a clinical trial for a new catheterization procedure to fix the valve.
But when I discovered the risk, it turned out that there were more risks to that than the open heart. And at my age, I'm 90 now, and I've had a great life, and I didn't want to wind up with a stroke. So I said, well, I prayed about it. I spoke to the priest of my church, and I felt that I had a clear message from the Lord to let nature take its course. So that's where I am now, and I'm very comfortable with it.
Knock, knock. Hello, Mrs. Fox?
Oh, hi, Susan.
Religion is important to Mickey, and in addition to support from her church, she receives visits from a hospice chaplain, Susan Mitchell.
So what's been on your mind these days?
Well, I've been thinking how much you helped to pull me through the hard times. And now I'm just kind of going with the flow and enjoying life and planning ahead. I was very anxious, but I think through your helping me, teaching me how to meditate, that was great.
So have you been doing that, like at night before you go to bed? Or?
I do.
I define spirituality, and the hospice community defines it very broadly as a relationship to someone or something greater than yourself. A sense of belonging, a sense of transcendence, a sense that there's something more. You know, we don't specify what that something more is. It can be religion. Mrs. Fox is very religious, and so she has that vocabulary.
Has your prayer changed as you had gone through this experience the
My
last
prayer-
several months?
Well, I think, I had a sort of a routine way of praying so that I sort of covered all the bases.
And so we offer, first and foremost, a listening presence. As a chaplain, I don't judge anyone. I meet someone where they are. No chaplain will proselytize or try to convert you or save you or change your beliefs. We are there for you. So what I tried to do is kind of gently guide them to coming to their own answers. It's not important what I believe, it's important what they believe and what they need at the end of life.
Dr. Herbert Netchin is another hospice patient who enjoys visits from a hospice chaplain. But unlike Mickey Fox, Dr. Netchin is Jewish, and he's not religious.
Not all people who are spiritual are religious. I do not find for myself that religion helps me. But I do admire those who are able to think that way. It gives them comfort. It does not comfort me.
Despite that, Dr. Netchin values the time he spends with hospice chaplain Avis Hoyt O'Connor.
I enjoy talking to her. In fact, I didn't know she was a chaplain. I saw the title, but I had not at all concentrated upon it. I viewed her as a person, and we talk about many, many things. And I think that is what I find helpful.
So for me, spirituality is all those things that...
We talk. We can talk about how I feel and about what I've done and some of the things that are going on at the present time, all of which I think are part of spirituality.
Gary Fink is Vice President of Spiritual Care and Volunteer Services at Montgomery Hospice in Rockville, Maryland. He's also a rabbi. Welcome, Rabbi Fink.
Thank you, Frank.
Well, this is so interesting and such an important part of the journey. Spirituality, religiousness. Do you have to be religious to receive or benefit from hospice care?
When I see a patient or a family, my first question is not going to be, do you believe in God? But early on our conversation, I may ask, what is meaningful to you? What brings meaning to your life at this particular time?
And what do they say?
For some people, it is all about a relationship with God. For other people, it's about a relationship with family members, with husband, wife, with friends, or a relationship with family members who are long gone.
Do you have to ask hospice for this spiritual support, or does it come in the door with the team?
Spiritual support is always offered as part of the hospice program, and chaplains or spiritual counselors are always available as part of that team. A family member, a patient may decline spiritual care. Others may welcome a chaplain just to have someone to talk to, someone who is non-judgmental, someone to help an individual frame and make sense of what's going on.
If you are sitting with a patient and they reach out to you and they say, tell me what my life has meant. Here I am at the end. It went by in a flash. What do you tell them?
Sometimes a question is not an invitation for an answer, but is an invitation for a conversation. So my response is to expand the conversation. Tell me about your life. Where did you grow up? Tell me about your parents, what has been meaningful to you, your challenges, what are you proud of, what regrets do you have? Sometimes life review can be a very profound spiritual activity because it helps an individual sort out what is meaningful to give them comfort as they look back on their life as they're moving towards the end of their life.
Life review. Great term. What kinds of things do patients think about accomplishing or doing in their time remaining? Do they talk to you about that? Is that a big part of the spiritual conversation?
Sometimes there is unfinished business. It could be very simple, it could be very profound. Sometimes it is as simple as one last visit to the local baseball stadium. We had a patient for whom we at Montgomery Hospice arranged oxygen and wheelchair and transportation for one last visit to the local ballpark. And that was his spiritual fulfillment at the end of his life. For others, it involves that which has been unsaid, saying to loved ones, I love you, I forgive you, reviewing with loved ones that which had never been articulated.
We are such a diverse culture. How does hospice handle this vast diversity of religiosity, belief, and spirituality?
Part of that, I think, comes from the training that hospice chaplains receive, training in broad cultural competencies. What do other faiths do? Sometimes that means calling in the local pastor or monk or imam or bringing in resources from the outside, as long as we can find someone else or another source to provide that comfort.
Rabbi Gary Fink, thank you so much. Appreciate it. We've been talking about how hospice can help someone approaching the end of life, but many people may not be aware that hospice also provides support for family members and other caregivers after their loved ones have passed away. We spoke to Nancy Smith about her experience. Michael Smith passed away in late March of 2012 at age 51 after his long struggle with cancer. His wife, Nancy, remembers her first reaction.
I'll tell you, it had been so bad, and that it was a huge relief. The relief lasted a long time. To the extent that we got used to saying to people, comforting others, you know, what I'd say is, anybody who lived in this house can be nothing but grateful it's over. So for a long time, I think we were all in this position of making other people feel better about this. That relief got us through a long time.
Nancy was also busy. There was the funeral, then senior prom and high school graduation, getting the twins ready to go off to college. When the hospice social worker first called to offer help, Nancy declined. She didn't have time to grieve.
At some point in the spring, I had gotten a call from Franz Moore at Hospice about this is a service we provide, and when you're ready. And when all of that dust settled and I finally had time to kind of think about me, I finally also started with the bereavement support from Hospice.
She called as soon as the boys left for school and became an empty nester, which was another loss. And we began some individual counseling at that time.
I just felt, this opportunity's been given to me. I'd never gone to counseling before. I didn't know anything about it. And I started one-on-one with Fran.
Many people don't really fully start feeling their feelings until several months have passed. And that's when it gets really painful and difficult, and they could use the extra support, and they seek it out then.
It was very helpful to have somebody come at this in terms of here's where you are, and you people have the capacity to stay there or wallow or move up. And, to have somebody say to me, I think you're a person who can move up, gain something from this and give back, was very helpful to me and very affirming,
I'm very clear that I'm not going to fix this. I'm not going to make the person come back. I don't have magic potions to provide.
It was very helpful in kind of saying, I'm going to get my life back in order and look at things as me, not as the wife of Michael. It's very different.
What I can do is be a really good listener and offer some suggestions as to things that they can do, that any bereaved person can do to try to get through the process.
And so I really enjoyed my time with her, and she pushed me very hard to get into a grief support group. And I was not as gung-ho about that.
She was really, as I recall, kind of reluctant to participate in our bereavement support group. And I thought that it would be a nice next step for her. And she did.
You have a common ground in losing a spouse. Somebody was talking about, what do you do on the first anniversary of their death? How am I going to go to this wedding I was invited to by myself? Things that seem obvious, but they're not. It was very beneficial. Fran was right.
And joining me now is Dr. Kenneth Doka, professor of gerontology at the Graduate School of the College of New Rochelle and senior consultant to the Hospice Foundation of America. Dr. Doka is also a Lutheran minister, as well as an author, editor, and expert on grief and grieving. Ken, good to see you.
Good to see you again, Frank.
It is striking watching Nancy's story. She talks about a huge relief. She talks about how grateful everyone was that it was all over. But even now, she's overcome with emotion as she even speaks about that.
Yeah. I think one of the things we sometimes do is we associate grief with sadness, with loneliness, with yearning. And in reality, grief is any reaction we have to the loss. And it's not unusual after a long experience of caregiving that the first reaction one might have is, thank God it's over. And then the person may have, over time, a series of other reactions.
Do you find that caregivers often forget to or don't have time for or the luxury of taking care of themselves?
Oh, that's often a major issue with caregivers, that it becomes so absorbing. As a matter of fact, there's even a study that says that caregivers have sometimes a much higher mortality rate because they don't take care of themselves.
While they're in the caregiving process?
While they're in the caregiving process.
Wow. So what is hospice's role in that?
Well, I think hospice's role is twofold. One is obviously by the services they provide, by the emotional support they provide during the course of the illness to provide some respite to the caregiver and certainly to emphasize the need to self-care. But after that, and this is, I think, an often unrealized benefit to the general public about hospice, they provide bereavement services usually for at least a year, much like Nancy had it.
I loved the moment in the video where Nancy said, referring to her grief counseling, this person said, "You're a person who can move up." And I watched you watching that and you nodded your head.
You know, I think some people, you know, they're really diminished by the death and they never find life meaningful or as meaningful again. But other people find what some people have called post-traumatic growth. They find new strengths, new abilities, new insights, deeper spirituality. And the support that hospice can provide can often help people find those strengths and grow up in grief.
And when should people seek support?
Well, I think the question is if you feel you need support, if you feel you're not getting support, reach out to it. And I think, you know, Nancy's a good example there. She probably had, when the twins were there, they probably were a good support system for her.
They kept her busy.
They kept her busy. They kept her involved. She could probably talk about her husband with them. They could probably reminisce. Once they were gone, she needed help.
This notion of she didn't have time to grieve. Do you find that is also a common experience?
You know, what we find in most people is that they're doing a little bit better right after the loss. And then I always describe grief as a kind of roller coaster. So, you know, when you get on the roller coaster, at first it's not so bad. And then you hit that first decline. Because you have to plan the funeral. You have to send thank you cards. There's a lot of work that needs to be done. You're still in shock.
And you're surrounded by people.
And you're surrounded by people. And then, you know, I always remember one widow who said, the first time I began to grieve was when I went to my mailbox and there wasn't a sympathy card, and I went to my answering machine and there wasn't a sympathy message, and I said, now I realize I'm alone.
Finally, this, Ken, what kind of conversation should people have with themselves or with their loved ones before they're in hospice about this kind of thing?
Probably my answer would be, is the best conversations to have are the conversations that finish business. You know, I've seen more people come in grief counseling saying, I never told him I loved him, I never told her I loved her. You know, so say what you need.